Well, the Choosing Wisely campaign actually has done a great deal to raise the awareness of the importance of the role of laboratory medicine in terms of healthcare in the medical community and in the public community as well. I think one of the things that will come of this, and already has to some extent, is the increased request for professional consultation from pathologists and laboratory professionals about effective utilization of laboratory testing, not just the ones that are on the Choosing Wisely list, but really engagement in general about better use of diagnostic services.
You know, as a laboratory professional, I think my role in the Choosing Wisely campaign at my own facility has been to get the ball rolling, to raise the awareness of senior leadership and get their buy-in, to get the development of our test utilization program going, to begin to get our leaders like our Chief Medical Officer to help me engage physicians in this process, to begin the work of that test utilization committee, and to make sure that we have the data that we need to make the changes that are necessary. You know, another success that we've had with Choosing Wisely has been the engagement of our own laboratory staff. Our medical laboratory scientists, our cytologists, our histologists, our technologists have really gotten excited about this program. And now I find them coming to me. They have ideas on tests that they see being ordered inappropriately, tests that are either duplicates or they're probably misunderstood by the physician. And I find that they're calling up the physician to clarify the test order with them so that we're sure that we get the right test for the right patient at the right time.
First thing I would say is understand and get comfortable with the Choosing Wisely recommendations. Those are 10 easy steps that I think, there's good data behind, all of these recommendations. There's exceptions to all of them, yeah, but this DA would be able to get rid of 80% of your inappropriate testing if you implemented them well. On the other hand, you can look at the very, very high cost, say molecular tests and exomes, and really make sure that you're utilizing those very wisely and very appropriately, because one of those, if you could not do it, pays for a lot of common tests. So it depends on which of those two extremes you want to look at, or both.
One of the first recommendations that we implemented was had to do with vitamin D screening for population health. And we found a relatively good acceptance rate of the physicians to an alert sharing with them the information that vitamin D tests for population health screening may not be appropriate. And so we looked at canceled orders, and we also looked at the decreased rate of ordering vitamin D tests per 1,000 patients, and we found a savings annualized in the first year of over $400,000 from just an alert hardwired into our electronic health record with that single recommendation alone.
And in fact, I feel that the pathologist plays a special role. We care for many, many patients that we will never see. But our involvement and work behind the scenes in managing laboratories, assuring quality of patient testing, and assuring that physicians who utilize our services understand the best tests to order to improve diagnosis and treatment for their patients. So while we may not interface directly with individual patients on a daily basis, the work we do improves and assures the quality of care for all patients.